Yes, great. Well, welcome. I'm glad that I could attend your career fair. And like Mr. Soderbeck said, to please put any questions you have in the chat and I will answer as many as I can. It seems like we have a lot of people that are interested in nursing, and that's excellent. So nursing and healthcare is a field that has served me very well, um, being a local person here as well. So I can get started. We're good?
Yes.
Okay, so yeah, I'm a registered nurse, and what that means, it means a lot of different things. It means that I get to do um, various roles in the community. So all of these people pictured here could be an RN. You can do things in surgery, or you could do things out in the community, giving the vaccinations, being a home healthcare nurse and seeing people in the home, working in the emergency room, working trauma, working in ambulance care or psychiatric care. So it means a lot of things. And once you get your RN degree, then you get to, a lot of things open up for you. So I'm currently the chair at the nursing department at Palomar College. So we're celebrating actually our 51st year now in the community. So we've had a nursing program for 51 years now in the community. And not only am I the chair of the department, but I'm also a graduate of the program. So I graduated, I'm going to date myself a little bit. I graduated in 1995 before many of you were born, I'm sure. So I graduated as an RN in 1995. And then I went on and I got a bachelor's degree and a master's degree in nursing. And now I'm back teaching at Palomar College, and I love it. We have a great program at Palomar College. What being a nurse is you've got many different roles. There's many different people that work in this building. So, while most of you know about nurses and doctors, there are so many different fields that work in healthcare. There are, dietitians and respiratory therapists and social workers and program directors and case managers and physical therapy, occupational therapy, research that's going on in the building. So if you're interested in healthcare, I'm very grateful that you're here listening to a presentation on nursing, but just know that you have many different options in healthcare. There are so many different roles in healthcare that you can experience, and they all have varying degrees of education that's required. They all have usually there'll be people from in every discipline, from people that are technicians to people that have master's or doctorate degrees. So there are a lot of people that are in the building. So I just want you to be aware of that and not just limit yourself to I have to either be a doctor or a nurse if I want to go into healthcare. So as a nurse, there's different levels of being a nurse. So there is a CNA who has a few hours of training, all the way up to advanced degree nurses and nurses that have their doctorate in nursing. So there are all different levels of education within nursing. So a CNA, it's a great place to start, and you could get a certificate over the summer. If you're in high school, there are some free programs to get a CNA. It also gets your foot in the building. So it lets you work in healthcare or in a hospital environment. And you assist the nurses, and you can see all the different roles that are in healthcare and get paid while you do it. So they're in very high demand right now, especially with the COVID situation. Very, very high demand. So there's all different levels of nursing, and you can see all the different educational levels that occur. And of course, as your education goes up, generally your salary goes up as well. So you can make a very good living as a nurse. So again, there's different degrees in nursing. I teach at an associate degree nursing level, which is right here. And I have my master's degree, which is right here. Many of my colleagues have their doctoral degree, which is here. And when you get a doctoral degree, you are called doctor. It doesn't make you a doctor, but in the sense that, you're now a medical doctor, but you do have a doctorate in nursing. So there's a lot of people that have their doctorate that are in different fields. So nursing and medicine go very hand in hand. We're on the same team. We're both taking care of the patient, but it's very different. They're different fields. So nursing is different than medicine, but we're both contributing and caring for a patient. So just in different ways. So about myself a little bit, I started out, I got my degree from Palomar College in '95, and I started out actually at a mental facility for adolescent psychiatric patients. So from there, I ended up getting a medical surgical position on the floor at Scripps Memorial La Jolla. And from then I worked in intensive care at Scripps Memorial Hospital in La Jolla for most of my career. So I did intensive care for most of my bedside career. And then when I got my master's degree, I was working as what's called a clinical nurse mentor at the hospital. So I was teaching nurses at the bedside. And I really liked the teaching aspect of nursing. So I went to do that full time. So I've been at Palomar College now for about 10 years. But there's so many different things you can do in nursing. You know, if you like a lot of really fast-paced things, you can go work intensive care or emergency room. If you like, you know, moderate pace, you can do like a floor, like a medical surgical floor, or you could go work kidney dialysis, or you can really specialize and become a diabetic nurse educator. There's just so many different ways you can go in nursing. It's kind of nice because you can do a lot of other things. I've also done emergency room. I've done that for a little bit. I also did critical care transport. So that's taking pretty sick patients in an ambulance from one hospital to another. And now I'm a nursing instructor. So I teach nurses at the bedside as well as in class. So this is just an example of some of our Palomar College students. Don't let these zombies here scare you. That was for Halloween. We had a Halloween walk, and we all dressed up as zombies. That was our theme. And we got to, this was not this past October, but before COVID. We also do a lot of other walks in the community, and it really becomes a family. Your nursing cohort becomes a family for you. They end up very, very close. They bond for life. I still have friends that I had from nursing school. So your cohort, you go through a lot together. So how much do we make? Because that's really what you guys want to know, right? How much money can I make? So it depends on what you do in healthcare. As an RN, I would say this is the median salary right now, about 71,000. You can make a lot more than that. You can make less than that. And a lot of nurses sometimes go part-time if they have families, or if they want to go back to school, or if they want to do other things. So, you know, of course, you can make a lot less if you're working part-time. An LVN, this is an average salary for the LVNs, about 46,000. And then there's other areas. So a CNA would make about $30,000, and that's per year. So the average salary in San Diego locally is about $43 an hour, and a typical range is between $44,000 to $100,000 per year. If you have an advanced degree in nursing, then you can make usually over $100,000 a year. I have friends that make over $300,000 a year, like in the operating room. Just depends on what they do and how much they want to work. There's always extra work to do. So we usually do 12-hour shifts. 3 12-hour shifts in a hospital environment is 36 hours a week, and that's considered full-time. And then there's also always calling you for extra shifts, always. So there's a lot of opportunities to make overtime if that's what you would like to do. So what do I like about nursing is that there's no 2 days are the same. There's just a lot of variety in the field. Even, if you're on the same floor every day, you've got different people, you've got different diagnoses coming in, different surgeries coming in, different lots of different people you meet with the families or with the patients or with their different diagnoses, or they're not responding the way that they should. Also, people trust nurses. We are the most trusted profession for years and years and years and years. We're trusted more than physicians are. You get to meet a lot of different people, and then at the end of the day, that you've made a difference in somebody's life. You know that your actions have helped somebody to either recover or to get through something, or to manage their pain, or even if you're just helping them ease them out in the world. Also, it's helpful that I feel like I could help if there was an accident or maybe even a zombie apocalypse, that then I can also help with. So there's a lot of varieties. I'm a nurse educator, but I like that job too because I'm never bored. There's a lot of variety. There's a lot of different students that need assistance or need assistance in different ways. And you're never bored. And I only have to work 32 weeks a year, which is kind of nice. I get a few weeks off per year. And as an educator, I get to help train others to then help in the zombie apocalypse. Not that I think it's coming, but it could always happen. So what's the difference between a doctor and a nurse? There's a lot of different roles that are done in the hospital environment or in an acute care environment, or any environment has pretty much doctors and nurses, but we're both taking care of patients. So a doctor is going to diagnose them like, hey, you've been infected with something. They're going to diagnose something. And then a nurse would help out by saying, okay, let's get you cleaned up. Let's get your wounds tended to. Let's, treat the patient kind of as a whole. So we take that diagnosis and then we run with it. The nurses are the ones that are at the bedside 24 hours a day, 7 days a week. So we are the eyes and the ears on the patient, where we identify when things are not correct or not, the patient's trending in the wrong way. We can identify if the patient's doing better or doing worse, and then call the physician so that the physician can take care of something or give us more orders, or we work together as a team in order to care for the patient, the whole patient. So nursing is also a good career to go into or to get started on if you're not sure what you want to do with your life. It's a lot of a responsibility when you get to the age that you guys are getting at, and people are asking you, what do you want to do? What do you want to do with your life? What do you want to be? It's a big responsibility. You spend a long time at work. You spend a lot of time, in your career, in your job. And if you're not sure what you want to do with your life, you can get started with the nursing prerequisites, and you don't have to decide what you want to do kind of ever. As a nurse, I can go, if I feel like I'm being way too stressed out in the hospital, I can go work at the blood bank, or I can do home health, or I could do chart review or case management, or or if I feel like I'm getting bored in my role, then I can go and move into a different environment and go do critical care transport, or go work on a helicopter, or go help out in other areas. So in nursing school, we expose you to several different types of nursing. So you'll get the medical surgical nursing, which is the majority of what nurses will do, help patients with either a medical issue or a surgical issue. And then you also get to do OB/GYN nursing, which is, babies, delivering babies. And then psychiatric nursing, we give you a little glimpse at that, and pediatric nursing, so working with children, and geriatric nursing, working with those that are like 65 and older. So there's so many options. You really never have to fully decide. You can keep changing up your career if you'd like to, and go in different directions as you go on with your life. So if you're interested in nursing, and you're still in high school, I would recommend taking some math courses, science courses, and psychology courses, and really trying to get a good level of understanding of those. You can actually start your prerequisites at Palomar or at another community college while you're still in high school. If you want to do some night classes, it's very easy right now. Everything's on Zoom, and we have some dual enrollment opportunities. If you're finishing high school right now, then you can start your prerequisites in college, or you can take a gap year and then start then. So if you're interested in nursing, we do a lot of the sciences, so the prerequisites have a lot of sciences. We have a lot of anatomy, physiology, micro are all prerequisites. And then there's math. So you have to be kind of good at math to be a nurse, but really all we need you to be able to do is add, subtract, multiply, divide, and deal with fractions a little bit. And there are a lot of people that come into nursing, I teach in the very first semester of nursing. So they are very scared about the math exam because you have to get an A on it. But I've only in my entire career in 10 years, I think I've only failed one person out because of math. So it's definitely doable math. We give you calculators, don't let math scare you from any career. Sometimes students have the stigma with math, but don't let math limit you with what you feel your options are. You need to take an English course, a speech course, and a psychology or a sociology course as well. Those are all prerequisites to get into the nursing program. If you're interested in nursing, I recommend taking the prerequisites first and then doing some of your other elective courses while you're waiting to get into the program. And there's that can be found at this website here. So wherever you go, whatever you do in your travels, I'm going to recommend that you go to an accredited college. It means a world of difference. So if you are interested in nursing, there are several nursing programs in this area, not just Palomar College, but there's also MiraCosta and Cal State San Marcos. They both have nursing programs up here in North County. But wherever you go, whatever you do, please make sure to go to an accredited college. It means a big, big, big difference. Whether you can take your degree that you get there and move on and go to other schools with your degree, or if you get a job or not. So you want to make sure to go to an accredited college. All of these schools in this area have very reasonable costs. The MiraCosta and Palomar College are going to pay community college prices, which are very reasonable. I want to say it's about $5,000 to $6,000 for the entire degree. So that is a bargain, because when you get out of nursing school, you're going to be making between $40,000 and $70,000 a year. So even if you have to take some loans, it's very easy to pay it back. Cal State San Marcos will be a little bit more because it's a 4-year university, but all of these colleges in your area here have a nursing program that are very reasonable. You will see advertisements for other colleges or try to, get you to pay, like $6,000 for a CNA degree. And please, if it seems an exorbitant amount or a cost, then please check out the college, make sure that they're accredited, and maybe check out other colleges to make sure that you're not paying too much for a degree that maybe won't help you in the future. You can also volunteer right now. If you volunteer, you get extra points on your nursing application. And Scripps has a volunteer program, so does Palomar, so does Tri-City. They all have volunteer programs for either high school students or college students to be able to let you kind of get in the door and to volunteer at their facilities. And that's another good way to get extra points on your nursing application, and also to be able to kind of be in that environment and see what it's all about. You can also get a CPR card. If you get a CPR card, it needs to be through American Heart Association for the nursing program, just so that you know that. But if you get a CPR card, it kind of helps you a little bit to understand and to help people in case they're in need. You also want to stay out of trouble, because as nurses, we go through very extensive background checks. We have medical exam forms and background checks and drug screens that need to occur before you get into nursing school. These are the costs for the program, so you can see how much they are per semester. And this is after your prerequisites. And that information is also available on our website. So who can be a nurse? You can do it. You can do it if you want to do it. Set your mind to it. Take some courses, each semester. Even if you have to work, I had to work full time when I was going through school, but it was doable. I was able to do it. And then also, if you go through the community college route, you can start earning RN money while you go and you get advanced degrees. So if you have any questions, my email is there. You could also, we have orientation sessions that you can attend, and those are virtual now. and maybe talk to a counselor either at the college or at your high school if you'd like. But I'd like to have some time to do some questions if there are some. Yeah, let me see.
I think we have some in the chat here. Jared asked, how long does it take you to get a doctorate?
A doctorate in nursing?
Yeah.
Yeah, so that would be a 4-year degree to get your bachelor's, and then you could maybe do it in 5 or 6 years to get a master's, and probably about 7 or 8 years to get a doctorate. If you're going to get a doctoral degree in medicine, it's usually about 10 to 12 years. But again, if you do it in stages and in steps, then you can make RN money while you are getting your doctorate. And it's a little bit easier when you can feed yourself and clothe yourself and live.
And we have a question from Leslie, which is, do nurses have to do a sort of residency?
So nurses, and depends on what program you go into, but to get your RN degree, we do clinicals. So we start at week 4 in the program. We get you all ready to go into the hospital, and then we do like 12 hours a day at the hospital once a week. So throughout nursing school, you're doing what's kind of like a residency. And then in the 4th semester, we have a preceptorship, which is 4 weeks long, where you're just shadowing and doing the work of a nurse. So not every program has a preceptorship, and they are getting harder to find right now with COVID. But you don't have to do a residency like a physician does a residency as far as in each field. But like when I went to intensive care, I had from going to the floor, then going to intensive care, I had a 6-week training program to go to the intensive care unit. So they're not like physician residencies, but you do work in the field while you're training.
Another question we had is, what skills do you need in order to succeed at this job?
Well, to succeed in nursing school, what you really need to do is follow directions. That is like the biggest thing that you can do. Other skills would be, being able to talk to other people, not being, too shy or too forward with other people, because people tell you a lot of things, and you have to be able to watch your nonverbal and keep a straight face when you do that. But really, a desire to work in the field, being able to follow directions, and then nursing school will get you beyond that.
Other questions we have are, what does your day-to-day look like when you're at the hospital?
That's a great question. So when you're at the hospital, you come in, you get report from another nurse on your patient or patients, depending on where you work. And then usually you give, you want to go through and you do a head-to-toe assessment on the patient. So you look at the patient, look at their wound, so let's say you got 4 patients, you want to see each patient, and then you give them medications and organize their care. You're really like kind of the captain of the ship when you're the RN. And, so if the patient needs physical therapy, or if they need to go to surgery, or if they need to go wherever they need to go, or whatever they need to do, you need to prep them for those things. All the while throughout the day, you're managing the team. So you're letting your CNA know what the patient needs, or making sure that they've gotten a bath, or that they've eaten, and that they've gotten the right food to eat. And then you usually get to have a break and a lunchtime. And then you go through and you reassess the patients. And while you're doing that, you're treating wounds or doing, whatever floor you're on, doing your care with the patients. And then you give report to the next nurse. So that's just kind of it in like a nutshell. But it's a very rewarding career, because especially in the intensive care unit, I knew there are days that I knew going home that I saved that person's life, that there is no doubt about it, that my actions helped to save their life, or did save their life, or the medication that I gave, or the my call to the doctor and getting them into surgery right away, and my communication with the doctor, saved their life. So it's very, very rewarding. And then you've got family members that kind of come back, and or a patient that gets better and comes back, and just appreciates your care. There's nothing like it. It is extremely rewarding.
And we had a couple of other questions here. One about was pay, the other was education needed, and we kind of covered that in pretty good detail. We had at what stage can you actually do real work or hands-on work? At what stage of being a nurse?
So even if you're a CNA, you can go through, I think it's 6 weeks of training. It's not very many hours. I want to say 120 hours. And you start doing hands-on with the patient. As if you go to nursing school, you don't have to be a CNA first for our program. For some programs you do. But if you want to, start hands-on as an RN, we start that in nursing school 4 weeks into the program. So we get you all ready to go. And 4 weeks in, we're sending you out there to work in a hospital with real patients. And some of them are even able to give medications at that time. So it's pretty quick that you get to do hands-on care. If that's what you want to do is just hands-on care and you don't really care that much about the pay, CNA is a great way to go because you get to spend a lot of time with just the patient.
The question we have was, how are the courses and clinicals different at the associate's level compared to a bachelor's?
That's a great question. So they're not that different. That we do in the associate's degree level, we get more clinical time, so more time at the hospital. It takes you, honestly, it takes you about the same amount of time. It's a lot cheaper to go to a community college than a 4-year university. So that's one benefit to going to a community college. But it takes about the same amount of time because you have to get your prerequisites in, and that takes about 2 years. And then you have to go through the nursing program, which is about 2 years. So, you end up getting a 2-year degree from a community college, but it's a lot less and you have more clinical time. We don't do in the community college, we don't really do leadership and management as much as they spend in the 4-year university. At the 4-year university, your last year is pretty much like community management and leadership type roles in a bachelor's program. So that's how they differ a little bit. But honestly, if money is an issue, which for me, going through school, money was a huge issue. I really couldn't afford school and to live at the same time. I was on my own and I didn't really have any family support for financially. So the community college was the absolute way to go for me because it allowed me to get out to make RN money while I continued on with my education. But if you can go to just a 4-year university, or if money is not a problem, then that's another way to get a degree.
One of the questions we have is, how long or how many years does it take to be a nurse?
A nurse practitioner, was it?
Yeah, so looking for what's the career path for a nurse practitioner?
So there's a couple different ways that you can go. You can go RN, then get your bachelor's, and then go on and get an advanced degree in nursing to be a nurse practitioner. And that would probably be about a 6-year route to go that way. Or there's some MEPN programs that you can go into but you're going to have to go right in and just be immersed into the field. I know Point Loma has a MEPN program that you could attend, and it might be a little bit quicker. But if you want to be able to make nurse money or get nurse experience while you're getting your nurse practitioner, most of the people that I know that are nurse practitioners have went and got either a 2-year or 4-year degree in nursing and then went on from there and continued their education to get a nurse practitioner degree.
The question was, with all the things that you're doing on a day-to-day basis, how do you manage the emotional toll of working with people, who are patients who have needs and things like that? I think that's the nature of the question.
That can be very challenging. You can treat the patient a little bit more effectively if they're not, your loved one, your family member, your somebody If it is somebody that we usually will take ourselves off of that person's case because it is very hard and difficult to be able to do that. But it is very taxing. I worked intensive care, and I remember I had a patient that was the son of one of my coworkers. and he was dying, and we were sending him off to have organ donation. And it was one of the hardest days of my life. I mean, it's just really, really, really emotionally taxing. But there are people that that handle that very well. I handled it well for about 12 years, and then I started, coming home and just crying all the way home in the car. And that's when I knew that I needed to make a change. I needed to do something different. And that's when I went into education. So there are some people that handle it very well. There's other people that get in intensive care and want to get right out because they don't handle it well. And if that's the case, then you can go work, mother baby, or you can go work, again, you could sit at home and, do case management, or work for an insurance company. Or work for a lawyer. There are so many different things you can do in nursing, that when you kind of feel that emotional toll taking hold of you, then you can change paths usually.
If you had is, did you go to the RN to BSN program at SDSU? If so, what are your thoughts? Would you recommend it?
So I went to the RN program at Palomar College. Then I went to University of Phoenix to get my BSN. And then I was very fortunate that Scripps Hospital paid for my master's degree to go from a bachelor's degree to a master's degree at San Diego State. So I got my MSN from San Diego State. So, it just depends on your situation and what's right for you. For me, that was the way I needed to go because I couldn't afford to go to get a 4-year degree. And I have colleagues that went right to like Point Loma, and were able to just go right through Point Loma and, get their bachelor's right off the bat. So there's so many different routes for you to get there. It's up to you, what works best for you. I think that the community college is a terrific bargain, and honestly, I know I work for Palomar College, but at Palomar College, we have such an amazing reputation in the community. If you talk to any nurses at any hospital, at Palomar Hospital, they will take us as graduates over a bachelor's degree graduate because we have such a great reputation. But we're very hard on the students. We start day one, we start treating you like a nurse, and it's very effective. It's not, I had one student tell me one time that nursing school is not for sissies, and they were right. It's a lot of hard work, but it's very rewarding. It's a great rewarding career if you're interested in it.
Okay, I don't think we're going to have enough time for any more questions because we're going to end here in a minute, but this has been fantastic. I hope all the students have got a lot out of it here, especially all the students who are seriously interested in becoming a nurse. Her contact information is up there. I'd take a screenshot of that quickly if you can. I will post a video of this and contact information and point to that Palomar as well, coming in the coming weeks off the college and careers site. But thank you everybody for coming today. Thank our guests. Thank you instructors and students for being part of Career Weeks here. And I have got to head off to my next session, but thank you everybody.
Mr. Schoenebeck, can I interrupt for just a second, please? Sorry. For my students, we're supposed to meet, but right now I'm trying to get Canvas to log in. It says it's overcrowded. So be patient. Maybe in the next 5 or 10 minutes or so, they'll start working again.
Yeah,
But
Canvas is acting up right now.
I'm sorry?
Canvas is acting up right now. Mine is as well.
Yeah.
So just keep trying to log in.
All right.
Okay, guys. Thanks much. Take care.
Thank you for the opportunity.
Thank you.
Thank you.